Hi guys, welcome to the part 2 of glycogen storage disease. In our last video, I have taught you about glycogen synthase defect and the von Gierke disease. And today we are going to study about type 2 glycogen storage disease, which is also known as Pompe's disease. Why this is known as Pompe's disease? This was named after J.C. Pompe, who first described this disease in an infant in 1932. Discovered by J.C. Pompe in 1932. Okay, so this disease is also known as acid maltase deficiency. Acid maltase deficiency. So what happens in Pompe's disease? It is a rare inherited disorder which impairs with the body's ability to break down glycogen due to the deficiency of enzyme lysosomal alpha 1,4 glucosidase. Due to the deficiency of enzyme what? Lysosomal alpha 1,4 glucosidase. Okay, and what type of inheritance is there? Autosomal recessive manner. Autosomal recessive manner. What does this mean? This means that a child must inherit one defective gene from each of the parent to develop this order. One defective gene from each parent to develop this defect. So the defective gene in this case here is acid alpha glucosidase, which encodes the enzyme acid alpha glucosidase necessary for the glycogen breakdown. GAA, acid alpha glucosidase, encodes for acid alpha glucosidase. So the glycogen is again not breaking air and getting accumulated in the lysosomes, particularly in the muscular cells and affecting the muscles, leading to the progressive muscular weakness and other symptoms. Okay, leads to accumulation of glycogen in the lysosomes, disruption of normal cellular function, leading to muscular weakness throughout the body. So, what is Pompe's disease? Pompe's disease is an inherited disorder which leads to the deficiency of enzyme lysosomal alpha 1,4 glucosidase due to the defect in gene GAA, acid alpha glucosidase, also known as acid maltase deficiency. So, for your extra knowledge, this disease can be of three types: infantile onset, non-classical infantile onset, and the late onset. In the infantile onset, there will be the occurrence of symptom within the first few months of the life. And in the non-classical infantile onset, there will be the occurrence of symptom before the first year of the life. And in the late onset, there will be the occurrence of symptoms after childhood to the adulthood, in between the childhood and the adulthood. So, in the lab diagnosis, this disease can also show the increased level of creatine kinase and also the reduced or absent activity of the enzyme GAA. Lab diagnosis. Lab diagnosis. Increased activity of creatine kinase and reduced or absent activity of GAA, acid alpha glucosidase. We can also use the genetic testing and the muscular biopsy. And how do we manage this condition? This condition is managed by the enzyme replacement therapy with the recombinant human acid alpha glucosidase, which helps in the reduction of this glycogen accumulation. Treatment with Enzyme replacement therapy. Enzyme replacement therapy with recombinant human acid alpha glucosidase. And also the supportive care. Symptomatic management. Symptomatic management. So guys, this was Pompe's disease for you all. I hope you must have liked the video and please give your valuable feedback in the comments. Thank you.